Earlier this week, the nation's top doctor, the U.S. Surgeon General, declared gun violence a public health crisis in America. In his advisory, he said that firearm violence is now the leading cause of death for kids. We can't overstate that. Gun violence, the leading cause of death for kids. So he is calling for action from lawmakers, just like advocates right here in D.C. have been doing for years. Jess Arnold spoke with some of them, and Jess joins us live from Capitol Hill now. So Jess, what does this declaration of public health crisis really do?
Well, it calls out that we need to address this issue more holistically. It aggregates some striking data like what you mentioned there, Allison. It also, like you said, it prescribes some solutions in this advisory. What it does not do, though, is it does not change laws. It does not set aside funding for some of these solutions that are outlined in this advisory. All of that, all of the actual actionable change is still up to the folks who work here behind me here in the Capitol. Now, the Surgeon General, Dr. Vivek Murthy, he hopes that this advisory has a similar effect to past public health campaigns like the one against cigarette smoking and the one on seatbelt use, where calling out the issues did create meaningful change over time. Now, I want to draw your attention to some of the data points that his advisory highlights. 54% of U.S. adults say that they or family members have experienced a firearm-related incident in their lives. 6 in 10 adults worry sometimes, almost every day, or every day about a loved one becoming a victim of gun violence. Now, anecdotally, for many of the families that I speak with in D.C. every day, I would say that's almost 100% that are worrying all the time. Now, suicides with guns are also rising. So, Dr. Murthy suggests investing in critical research, implementing more prevention strategies, and increasing mental health care access. Those are all steps that groups like the Firearm Center hope lawmakers take.
You've got to go to the root causes. Equity in schools, affordable housing, and access to jobs and a living wage, and mental health and trauma support. Because how then do you tell a child that has experienced 5 to 8 gun violence related incidents in their lives, and they are just 15, that there's more, and expect them to want to do more? The research and the treatment and how we get at that research and that treatment is one of the more important things.
Now, multiple physicians organizations also agree with the Surgeon General's advisory, as well as with Brian Nickens, who you just heard from at the Firearm Center there, and all of them are calling for more action. From Capitol Hill, Jess Arnold, WUSA 9.